With the movement screens we're going to teach you, that gives you a really nice framework in which to screen clients in a very controlled environment. Now, that's going to help give you the correct tools to make the right decisions for that client's programming so they get the best exercise relevant to their needs. It's not going to catch everything, because not anything can catch everything. So the joint by joint approach is another form of movement assessment that you can use to help identify what clients need to do in their exercises in the gym. So it's another really good framework to work within. It's not perfect, no framework is, but it's a great way to get started and really helps to understand how resistance training works. So with the joint by joint approach, it was basically a system developed by Gray Cook and Mark Boyle, a developer of the functional movement screen and a strength coach, as an easy and accessible way to basically look at how the body moves. And they basically did this. They divided the bodies into joints that alternate between functions of stability and mobility. And when they broke down the commonly performed movements in the gym, now please remember, in the gym, this doesn't apply to backflips and stuff like that they found that the body follows a pretty predictable pattern of alternating between stability and mobility, which then allowed us to problem solve and find out what the problem was with someone. Was it a mobility restriction or was it a stability requirement that they had? And by doing that, it gave you a quick framework to work out exactly what you needed to do, how to cue, what corrective exercises you could use, or adjustments to help the client do the exercise in better form. So it's a really useful system. Now, the two concepts we just need to understand before we go into it are the concepts of mobility and stability. Mobility is the ability of a joint to move through its full physiological range of motion. So pretty simple. It's not flexibility. It's the ability of a joint to move through its full physiological range of motion, not hyperextending. And stability is the ability of a joint or structure to maintain control and integrity during movement or external stress. So maintain control and integrity doesn't mean to stay still. Okay, so this is something where a lot of people misunderstand it. When we look at something like the scapula, as we press overhead, the scapula upwardly rotates to follow the glenohumeral joint. That is demonstrating stability because it is maintaining control and integrity. If you're actually retracting and depressing your scapula for the whole time, you're actually losing stability at the glenohumeral joint and the scapulothoracic joint. Scapulohumeral joint, because what's happening is it's not actually maintaining integrity the whole time. So that's just an important concept to remember that we'll keep on coming back to again and again. And we need to kind of understand that if the body alternates between a primary need for mobility or stability, creating a stack system where the function in one area can impact the others above or below. And we're going to go through exactly how we can do that. So we have the big toe, which starts with mobility, which is essential for walking, running, and lunging. If we think back to the assessment module, the last one, I talked about how I used to actually assess this, which for a lot of people wasn't very useful at all, but it's something that you certainly need to consider in certain injury situations. Now, the foot needs to be stable. So a stable foundation provides excessive motion and supports effective force transfer. Flat feet often indicate inadequate stability. This doesn't mean the foot never pronates. It actually can go into pronation and supination. It doesn't have control through that as well. So when someone's in the bottom position of a squat and they're pushing, they should probably have some degree of pronation. Now, the ankle needs mobility. So we need adequate dorsiflexion for the majority of things that we do. And it also needs stability in the frontal plane, which is side to side. So we don't want to have a lateral ankle sprain. That's where we kind of really go into each joint has a primary need and then secondary needs as well. And even in some cases, tertiary needs. Now, the knee needs stability. It relies on controlled movement to prevent injuries, often caused by inward or outward motion. It also needs mobility as a secondary consideration in the sagittal plane. So you should be able to get your heel to the bum and fully lock out the knee. Now, hip mobility. The hip requires mobility in flexion, extension, and rotation. This function here can affect both the knees and the low back, and you see this a lot. The hip also has a frontal plane stability requirement as a secondary consideration. So the mobility has to come first. So hopefully you're starting to get the idea of it alternates between mobility and stability, and some joints do have secondary characteristics. And the lumbar spine is designed for stability. The vertebrae are quite big and chunky, and they should resist excessive motion. So core exercises should promote the stability rather than mobility. We'll go into that in our exercise selection stuff later. Thoracic spine needs mobility because it is very commonly restricted, and it benefits from exercises promoting extension, rotation, and lateral rib expansion, which is why so many people talk about breathing now. The scapula needs stability. It supports proper glenohumeral movement and reduces the risk of shoulder injuries. The shoulder or glenohumeral joint needs mobility. It's the most mobile joint in the body. Lower cervical spine needs stability, and the upper cervical spine needs mobility. We're not going to touch on that too much because it's beyond the scope of what we can do with our clients in fitness. So some of the interrelationships that we need to look at. If someone has shoulder pain, we'll fix that little typo later. A restricted thoracic spine can lead to impingement and pain during shoulder movement. So if you think, if I'm really rounded over, really kyphotic, I can't actually reach my arm overhead at all. But when I'm extended, I can go back heaps further. So a lot of times someone can have pain when pressing overhead. It's not the pain's in their shoulder, but the pain is actually being caused by somebody that's having a thoracic spine. And an unstable scapula exacerbates the issue by forcing the glenohumeral joint to compensate with excessive motion. So if we're all really rounded, the scapula is too anteriorly tilted, it's not going to move in the right place at the right time to follow the glenohumeral joint. With low back pain, if we have limited hip mobility in extension or rotation, we often result in compensation at the lumbar spine. So an example of that would be someone going down to a squat. They may not have adequate internal rotation and hip flexion. And what happens is they round the lower back. They get pain or discomfort because they're rounding the lower back under load. So if we address hip immobility, we basically reduce load on the lower back and sacrum. This still falls into load management. We're just shifting the load to the area where it needs to be rather than the area where it shouldn't be. So some coaches will say load management is everything. Yeah, it is, but how you get there is not just managing load and reducing volume. There's many ways to achieve load management, so it's not as simple as that. And number 3 could be flat feet. So an unstable foot affects the ankle and knee, leading to dysfunctions in gait and or squatting. So how do we implement? We start with the movement screens. We do the mobility drills. We monitor and adjust, and we educate clients. Pretty simple. So we still follow the initial patterns of what we're looking at, but if we're doing an exercise with a client and we see they start to fall out of these patterns, we look at what the problem could be. So if someone is doing a barbell bent over row, which is basically the end range position of a Romanian deadlift, they go into the end range position, they get there, it all looks good. Then after a period of time, they start to round the lumbar spine. That's not a lack of mobility at the hips. To get there, it's a stability requirement because they're actually fatiguing and they're running out of stability at the lumbar spine, causing them to round. If someone is doing a Romanian deadlift and they're going into the motion and then they start to prematurely round the lower back, that's a hip mobility issue because they've run out of hip mobility. They're starting to get it from the lower back. So you can apply this to any single movement that you do in the gym because the formula joint by joint works really well for that. So when your clients if we're doing this online, if we're filming things, okay, and saying it to our clients are saying to us, it allows us to actually identify what's going on without being there and without being hands-on, which is a really, really important thing. So guys, make sure you consistently review the joint by joint approach. When you're looking at exercises, go, is this respecting or following the joint by joint approach? Which joints need to be mobile? Which joints need to be stable? And then your ability to coach will increase incredibly fast.